Welcome back to Your Health radio and television program. We're talking about tuberculosis, a very important disease, an ancient disease. We want to tell you as much as we can about it because we want you to protect yourself. Our next guest is no stranger to any of you in our audience. We want to welcome her back, Dr. Lisa Hernandez, Deputy Health Officer of Monterey County. Thank you for joining us, taking time out of your busy schedule. And of course, we're talking about tuberculosis. And I know you have treated a number of cases. You help supervise the nursing team that Marcy Bro is over. Now, we talked briefly with Marcy about testing, but we didn't really get into it. Now, we can't just look at somebody and tell whether they've got tuberculosis or not. So tell us a bit, if you will, about the testing procedure to find out whether people have tuberculosis.
Sure. There are two ways to test. One is a tried and true older one form of testing, which is called a skin test. I think Marcy mentioned it, and it's a Mantoux TB skin test where they place a little bit of fluid underneath the skin and wait 2 to 3 days for the medicine to react under the skin. So the person comes in, gets tested one day, they inject the fluid underneath the skin, and then they have to come back 2 to 3 days later for the nurse or the healthcare provider to read the test to see whether there was a skin reaction. That's one way. The second way is a blood test that's done, that's been out for several years now, that is done just by taking some blood and looking at the blood sample to see if there has been a response by the body to tuberculosis. And that's done with taking blood one time and getting the results. So there's no need for the person to come back to get the test read. There's no need for a person to look at the skin and decide whether there's been a reaction. So it's better that way because there's no room for interpretation where some people might think that there's a reaction where another person might not. So those are the two types of testing.
And whether it's a positive or negative gives us an idea whether the person has or does not have tuberculosis.
Right. So if both test, if you have a positive test, whether it's the skin test or the blood test, that means that you've been exposed to tuberculosis. And then with that test, there are further things that need to be done for the workup to decide whether you have TB disease or infection.
Okay. Now, with the testing, the skin test has been around for a long time, but here in Monterey County, we're on the cutting edge, if you will, and this new blood test is something that I think is offered at the Monterey County Health Department's Public Health Lab, and in very few, if any, other labs in this region. So it's cutting edge stuff. We have the latest technology here at the Monterey County Health Department's Public Health Lab. Now, the accuracy of this blood test, is that greater than the accuracy of the skin test?
Yes. One of the reasons is what I mentioned already, which is it leaves out the chance for someone who's reading the test to interpret whether it's a reaction or not if it was a skin test. The blood test is easier to determine because it's done in the lab by special testing methods. The other thing is, so it is more specific in that sense. The other thing is that it looks specifically, the blood test looks specifically for Mycobacterium tuberculosis, so for TB, the bacteria that causes TB, and not any other bacteria in that same family. So there's a group of bacteria called Mycobacteria. And the skin test just it reacts to different types of mycobacteria, so different types of bacteria in that same family. So it might have been another type of bacteria that caused the skin reaction to show positive, but in the blood test, it's just TB. So that rules out any other chances for that being positive.
So because it's more specific, if we use that test, we don't have to use medication when we don't need it. We don't have to get people all upset. You have TB when maybe they really don't.
Right.
This is a more specific and more exact test.
Exactly. And the other thing is that we don't have to ask someone to come back 2 times to get the test read. So say it's someone who's working, a teacher or someone in a medical facility, they don't have to take 2 days off of work to come back to get that testing done. It's just a one-shot deal.
Okay, now having said that, we've talked about the testing. Who should be tested for TB?
Well, basically there's a list. If you think you've been exposed to someone that has TB, you should get tested. And Marcy mentioned the symptoms of tuberculosis before. And sometimes you get contacted to be tested, as Marcy mentioned, with the nursing staff and the TB control program. We do contact investigation, asking the person who has TB, who have they been around. So that's one. There are certain people who are at high risk because their immune systems are low due to cancer or HIV. Those folks may need to be tested. People who come from certain countries where TB is high, certain parts of Asia, Eastern Europe, Latin America, those areas, people need to be tested for TB. And oftentimes when you come into the United States, you're seeking residency. That's one of the battery of tests that you will be asked to have performed in your medical evaluation. People who work or who live in congregate living settings, so in a place where lots of people live, jails, prisons, some nursing homes. If you work in close quarters, those people who work or live in those settings are also at higher risk for getting tuberculosis and should be screened.
Now, suppose this test, either the skin test or the blood test, is positive. The first test, screening test. Mm-hmm. What's the next step? Are you automatically, do you have full-born TB and you need, as Marcy was saying, 6, 9, 12 months of treatment? What's the next step after that test is positive?
So whether it's the skin test or the blood test, if it's positive, then you need to get a medical evaluation. So that includes history, an exam where the doctor may or may not listen to your lungs and do a couple other physical parts of a physical exam. They'll also get a chest x-ray. And depending on the x-ray results and what you've provided in terms of history, you may need to provide sample of sputum. So they'll check your sputum to see if there's bacteria living in your lungs or in your respiratory tract.
And based on that, you decide what's the next step.
Yes.
So just having a positive skin test or just having a positive blood test doesn't necessarily mean you're going to be taking medication for a long time.
Right. There is a good chance so that you will be offered medication. So there's 2 different types of TB. There's active TB disease, and then there's latent TB infection.
Now this is something that we get a lot of questions about.
Yeah.
The difference in TB infection and TB disease. One, you tend to be sick, so you can't be around other people for a while. The other, you can't spread it, you're not sick, but still you should be treated. Tell us about the difference in those 2.
Well, first of all, so as you mentioned, you will need medication. You'll be offered medication for both. For the disease, as you mentioned, you're sick, you're coughing, or you're losing weight, you have fever, and you're contagious. So those are the big things with active disease. And what happens is that most times, TB is a bacteria. Mycobacterium tuberculosis is a bacteria that you get through breathing in. So it's an airborne. So you breathe it in, and it comes into your lungs. And your body can do 1 or 2 things. One, it can't fight it off, and you get disease in your lung, or it can move to other parts of your body as Marcy mentioned, to your central nervous system, to your bone, to your lymph nodes. And that's active TB, and you're symptomatic. You have the symptoms. Or you have the second kind, which is that your body, you breathe it in, it goes into your lungs, and then your body fights it. Your immune system is strong enough to fight it, and it basically walls it off. So it protects you from your organs, your lungs, from getting the symptoms. But the bacteria is still alive. It's inactive, but it's still alive. So when you have a blood test or the skin test, it shows that you've been exposed because you have the bacteria in your body. It's just not showing any symptoms at this point. Most people, that's all that happens, but some folks later on in life, or if their immune system drops down for one reason or the other, diabetes, HIV, cancer, old age, then you can have the inactive infection become active, and you get the symptoms that we mentioned already with active disease.
Now, this is interesting, and I want to make sure that our audience understands this. People can have the TB bacteria sitting in their lungs.
Yes.
And go about their business, work, play, whatever they're doing, and have no idea that it's there. But if there's some kind of stress in their life, another disease process happens, then that bacteria can reactivate and then infect their lungs or other parts of their body and get active TB.
Yes, and that's why even if you've been exposed and don't have active disease, we recommend that you do take treatment for latent TB so that you decrease your chances of getting active TB later on.
That's interesting. That's a hard thing for people to get their minds wrapped around, that they could have the TB bacteria in their lungs and not know it.
Right.
And they're not sick.
Right.
Now, you mentioned the TB skin test. And we know that some people get vaccinated in some countries, get vaccinated against TB. Talk to us about that, if you will, about being vaccinated for TB and how this impacts the test or testing that you might go through to see whether you have TB.
Right. It's a very common practice in a lot of countries to vaccinate children, especially in the first few years of life, to decrease their chances of getting the complications of tuberculosis. And it's common practice that people feel, oh, once I've been vaccinated against TB, my skin test or my testing for TB is always going to be positive. And that can be true early in life or right after you get the BCG vaccine, the TB vaccine, but it's not a reason not to get screened. With the skin test, it can be positive initially, but again, later on in life, it can it won't affect, the vaccine won't affect the results. But with the blood tests, that one will not react, it will not become positive if you've been vaccinated against TB in any point in your life.
So then the blood test is, if someone's been vaccinated before, the blood test might tell us more or be more accurate as to whether we're getting a positivity because of your previous vaccination or because you actually have TB.
Yes.
Okay, and that blood test can tell the difference, whereas with the TB skin test, we may not have been able to tell the difference.
Yes, there's always that gray zone with the skin test.
Okay, now the United States doesn't vaccinate against TB. Okay. Should they be vaccinating against TB?
Not really, because it's a vaccine that does work, and it has its place in certain countries where there's higher incidence than here in the United States of TB. Quite honestly, where more bang for your buck in terms of controlling TB here in the United States is in control and in education. But it does have a place in other countries where we see children having more complications and dying from TB because of exposure, inability to go to a medical provider and seek care.
Okay, so there are any number of occasions where someone might be tested. If they're symptomatic, if they've had this cough that's lasted for a few weeks, and it's not the smoker's cough, which people fall into that. I've had smoker's cough for 3 months. It's not a continuation of the flu or cold, just this productive cough for a long time. They should be tested. Some employers, and we'll talk some about that, some employers should want their employees to be tested. So there are any number of occasions to be tested, and there are at least 2 different types of testing, and then we further get into the physician examining the person and chest x-rays and sputum analysis. So the testing is very important and determines how the physician will treat that patient. Well, Dr. Hernandez, I want to thank you for spending this time with us, but again, this next segment, I want you and Marcy Marcy Bro to come back, because we're going to get more in depth into TB. We've got some questions that we've been hearing from people that we talk to in the community. We want to explore some of those. So again, thank you for sharing this time with us. We're going to take another short break now. We've been talking to Dr. Lisa Hernandez, Deputy Health Officer of Monterey County. We're trying to explore this issue of tuberculosis. We want you to understand what it is and what it isn't. Don't touch that dial. We'll be right back.